Hi, I'm Dr. Richard Facko from Palos Pediatric Dentistry, and today I'd like to answer a question that we get very often in our practice, which is what causes cavities in kids? And I like to think of it as cavities requiring four ingredients as sort of our recipe that lead to a cavity. And you have to have all four to get cavities. If you have 3 out of 4, you wouldn't get cavities. So I hope that by understanding the ingredients for a cavity, it better helps us understand our preventive approaches and which levers we can pull in different kids based on their habits and personalities that help them get fewer cavities, help lower their risk of cavities. So I think one thing important right off the bat is that cavities don't have one single cause, and then the challenge becomes there's no single solution. So I think the best approach is to work with your child's dentist to discuss what your child's habits are, what their challenges are in terms of changing those habits, and hopefully get some guidance that leads you to some real actionable improvement and change. So the four ingredients, if we think of it this way, the four ingredients of a cavity are the tooth surface, which includes the plaque, the sticky layer that lives on our tooth surface, carbohydrates, time, and bacteria. So let's start with the first one, the tooth surface. So on all of our teeth lives a film called plaque. And we're able to remove that plaque surface with a toothbrush and with floss. So when we brush our teeth, the manual action of the nylon bristles kind of scratching the surface of our teeth is removing the plaque from our teeth. Similarly with flossing, the string that goes in between our teeth is disrupting and removing that plaque, that film layer in between our teeth where they touch, where the toothbrush bristles can't reach. And so by manually disrupting plaque twice a day, we're disturbing that tooth surface in such a way that it lowers the risk of cavities forming. When we talk about brushing 2 minutes a day, my challenge for all of you, which I experienced myself, was the first time you use a timer and actually time yourself brushing for 2 minutes, you realize why no child will ever brush their teeth for 2 minutes unless they're supervised and using a timer. So for me, the biggest risk with toothbrushing is unsupervised children brushing their teeth, only because we know that they're never going to brush for 2 minutes unless they're supervised and timed. So my best recommendation is parent supervision using a timer twice a day to mechanically remove the plaque from our teeth. Notice I didn't mention toothpaste. So we have not a ton, but a few patients who really struggle finding any toothpaste whatsoever that they're compliant with, that they'll tolerate. So, some of our kids with, more sensitivity, sensory type issues can really struggle with the flavor of toothpaste. And the way that conversation usually evolves in the office is, the toothpaste itself, some of them contain abrasives, but most kids' toothpaste are a gel type. They don't provide much advantage in terms of mechanical removal of plaque from the teeth. What you're getting from the toothpaste is a fun flavor, which for some kids is appealing, but interestingly for other kids is the turnoff, and fluoride. So the real benefit to the toothpaste is the fluoride. It's not the mechanical removal of plaque. So in challenges where toothpaste flavor is really an issue, I'd encourage parents to brush their child's teeth without toothpaste, just with a little water on the brush. You can do an equally good job brushing their teeth with a plain toothbrush as you can with toothpaste. And if they'll let you, at the end, you put a little bit of toothpaste on and just kind of smear it around so that they're getting the benefit of the fluoride after you brush. But the most important thing is removing the plaque from the teeth, ideally twice a day. The next factor on our list is carbohydrates. So this is one that can be a little bit confusing at times. You leave the dentist office and you're really motivated to eliminate sugar from your kid's diet. Well, the real challenge is it's not only sugar that causes cavities, it's all carbohydrates, which are everywhere. So it's impossible and probably not healthy to eliminate all carbohydrates from our diet. But obviously removing sugar, or minimizing sugar from a practical perspective, especially in processed foods, and being careful with, again, especially the ultra-processed carbohydrates. So the goldfish crackers are my favorite example, where you look and the sugar content is low, and it makes you feel good. But the reality is, kids who are eating those goldfish crackers all day are at a higher risk for getting cavities than kids who aren't. So carbohydrates are second on the list, in no specific order. Third, we had bacteria. And so we know that cavities are caused by very specific types of bacteria. We're actually outnumbered, I think it's 3-1. I'd have to look that up. But I know that we're significantly outnumbered in our bodies, bacterial cells versus human cells, which is a fun thought experiment. Are we really human, or are we just globs of bacteria walking around? But I digress. Bacteria on the teeth eat those carbohydrates, sugars or carbs, and the byproduct of their metabolism is acid. So it's actually the acid that burns a hole in the tooth and causes a cavity. And so I think, if I go back to my life before being a dentist, and if I thought that bacteria caused cavities, I'd be inclined to think that they're tooth-eating bacteria. And that's not true. That's not how it happens. Those bacteria eat what we eat, and they prefer carbs, and then they secrete acid. So when they're left undisturbed on a tooth surface and they build their little house, their little colony, and they're eating and eating and eating and secreting acid in the same kind of centralized area over a period of time, it breaks down the tooth surface and you have a cavity. Once you have a cavity, now you have a place where no matter what you do from a mechanical cleaning standpoint, you can't clean inside that cavity. Which is why cavities over time always progress. Some progress faster than others, but cavities progress and need to be treated. The last ingredient, the last factor on our list, I said a couple times in the previous one, so I got a preview, but is time. And so cavities happen. It's a chronic disease. It's not an acute disease. I always chuckle a little bit when we see kids. November 1st is kind of my favorite example. And, I diagnose a couple cavities on November 1st. And a parent's natural reaction or response would be, my gosh, they ate so much candy yesterday. That's clearly why we're here and they have cavities. The truth is, nobody gets cavities on Halloween. We get cavities from our chronic, prolonged habits. So the plaque needs to sit undisturbed for a period of time on our teeth. We need to consume carbohydrates for a period of time. And we need to have those bacteria living in the plaque, eating the carbohydrates for a period of time in order for that acid to break down the surface of the tooth and lead to a cavity. So when I think about practical implications of time, kind of think on both a micro level and a macro level. So on the micro level, we want to minimize the frequency of carbohydrate intake and the duration of carbohydrate intake. So how long are the carbohydrates floating around in our kids' mouths over the course of a day? What's the total amount of time? And so trying to restrict kids to 3 meals, 2 snacks, I think is a good approach. And if they are starving and need to eat outside of those 5 times a day, that they're eating whole unprocessed foods as a quick, I absolutely need something. But in reality, if they're eating 3 meals, 2 snacks a day, probably shouldn't need to eat much outside of that. And then also thinking about duration. So my favorite example is the bowl of goldfish, low sugar, goldfish crackers in their playroom, where they have kind of free access to come and pick up a couple and throw them in their mouth and go play, and come back 5 minutes later and pick up a couple more and go play. And this goes on all day long. And before you know it, they've been consuming goldfish crackers for 6 hours versus eating literally the exact same bowl, the same amount of goldfish crackers. But they sit down and in 3 big handfuls, they chew them all up, swallow them, and then they go play for 6 hours. Is a better habit in terms of cavity risk than the prolonged snacking. So that's kind of the micro lens. So the throughout the course of the day, trying to minimize the frequency, duration. I think on a macro level, I try to think about what our kids are doing every day versus what they're doing for special occasions. And so again, at home, my kids on Halloween, I let them pretend that they're regular kids, and they go out and they eat all the candy. I mean, they just gorge themselves on candy on Halloween. But they know me and they know our household, and come November 1st, all that candy's out of the house. So it's a special event. Have at it, have fun, be normal. We get back to work the next day. And so that happens a handful of times a year. But the alternative is that Halloween candy that they get 6 pillowcases full of lingers in the house, and they eat a little bit every day. And I'm eating it now too, because I have a hard time resisting the temptation when it's in the house. And that leads into Thanksgiving and then Christmas and the holidays, and then Valentine's Day, and then the Easter and spring holidays. And before you know it, the one-time candy just never leaves the house. So looking at frequency, not only on the 24-hour cycle, how many times a day are they eating this, but how many times a month are they eating it? And do they really need to be eating candy every day? So I hope that's helpful. I hope that you can kind of understand a little bit better how a lot of times it's things that we don't think of right off the bat that cause cavities, which makes them as prevalent as they are and kind of hard to prevent. So in my experience, it's not candy that causes cavities, because every time your kid opens that Snickers bar, or you find the wrapper in their bedroom or whatever it is, we all get a little bit upset because we know it isn't healthy for them. But the things that tend to fly under the radar that don't tug at our heartstrings as much are the fruit juices. You bought organic juice and it's got an apple on the front, and my kid doesn't eat apples, but they'll drink a gallon of fruit juice in a day. So it clearly has to be better. It's like eating 70 apples. In reality, it's sugar water, and it sits on their teeth all day long. And because we don't have those negative emotions about it, because the packaging looks healthy, we're more likely to let them do that. And similar with the goldfish and other carbs. So again, I hope that helps give you some insight into how cavities form. The better we understand how they form, I think the better we can make decisions and change things at home in ways that reduce our kids' risk for cavities. So if you have questions, I think these are things that typically get covered in a preventive visit at a pediatric dental office. So when your kiddo goes in for a checkup, at our office, we're always asking questions about what they eat, what they drink, and kind of trying to pick up on some of that nuance in terms of frequency and duration, and then learning about your kids so that we can help provide real, actionable, practical guidance and recommendations. Asking those questions, if it doesn't get brought up at your child's dentist, asking those questions, hey, what are some risk factors for cavities that we might be able to modify in our house, I think is a great thing. So if you live in the Palos Heights area and ever want to pop in, we're always happy to have these conversations and kind of customize things for your kids. But I wish you all the best and hope to see you soon.